44-bed acute care facility located in the heart of Fergus, Ontario.
Our mission as a rural hospital is to enable people to achieve optimal health through a range of integrated health services, provided by a committed team working with a network of partners. We value caring, accountability, respect, excellence, all with integrity. Welcome to our 2012-13 annual report.
This year we performed 32,554 diagnostic procedures.
This year we admitted 2,377 patients to the hospital.
This year we provided 32,554 diagnostic imaging exams.
This year we delivered 395 babies.
I would like to express my thanks to all of our hospital staff, nursing staff, allied health professionals, and especially our medical staff for providing such excellent care. We have a hospital that we can be very proud of. We've had two physicians retire from their family practice this year. Dr. Alan Simpson and Dr. Peter McFedrin have been replaced by younger physicians taking over their practices and adding to the youth of our community and our medical staff. Dr. Cheryl Pridham has joined associates in Elora, as well as Dr. Brittany Brown and Dr. Eric O, who have also joined colleagues in Elora. Sadly, Dr. Robert English, who retired some years ago, died earlier this year, and his great legacy of promoting continuing medical education and bringing new physicians and recruits to our community will be very much remembered. We have had a many-year process of developing our medical education facilities in this community. As I mentioned earlier, Dr. English, who spearheaded this process a number of years ago, has led to a program where teaching medical students, clinical clerks, and family medicine residents, both from other communities and our own rural stream medical residents, have provided a breadth of medical education that has served very well our recruitment process and the provision of new physicians to other communities.
In August of 2011, Groves Hospital received approval to proceed with planning for a new hospital. The new hospital design will be based on a campus of care model, and much work has been done towards the project. We've hired new architects, functional planners, cost consultants, traffic studies were completed, functional plans and staff designs. The campus of care model brings together in one location many services, incorporating physicians' offices, the local family health team, long-term care and other services, so it kind of creates a one-stop shop for local residents for their health care. In December of 2012, the Provincial Health Minister, Deb Matthews, helped us unveil one of two signs marking the location of the new hospital. And the two signs are located on Beatty Line near Hill Street and behind the Wellington County Museum. I would like to thank our alliance partners, North Wellington Healthcare, the CCAC, Trellis, CMHA, Homewood, Wellington Terrace, and all of our other provider partners across the continuum of care for their help through this process. Together with the Waterloo Wellington LHIN and the ministry, we made great strides forward in 2012 toward a better integrated rural health delivery system that we hope will optimize health for citizens of Wellington County in the future.
The Foundation is a separate corporation governed by a volunteer board of directors who are dedicated to raising and stewarding funds for the advancement of healthcare at Groves Memorial Community Hospital. Because of your generosity over the last 10 years, the Foundation has been able to disperse over $4.8 million to the hospital. Thank you so much.
With the Foundation's help, we were able to buy a gamma probe this year, and this is used to treat breast cancer. Formerly, we had to send patients who required surgery with the gamma probe to another hospital, and we were able to repatriate our patients now that we have this probe. The benefit to this probe in surgery for breast cancer is the surgery is less invasive and there is a smaller chance of post-operative complications.
The Groves Volunteer Association continues to be a cornerstone of our success. Provided funding for many new pieces of equipment in 2012 through their operation of the New to Use store. And they continue to supply hundreds of hours of volunteer support and care in the hospital for programs like the New Help program.
We've been very fortunate in this community to have many generous donations brought to our store, and it was an amazing year. It allowed us to purchase a lot of equipment for the hospital, for Fergus Groves Hospital, and that's what we're all about.
This year, the Foundation helped us purchase this new state-of-the-art ultrasound machine, which has helped us improve our diagnostic capabilities.
We started the Hospital Elder Life program here at Groves in October 2012, and it's a program specifically designed to prevent delirium as well as functional decline in older patients that are admitted to the hospital. So we have specially trained volunteers that provide interventions to our older patients that are age 70 or above. Volunteers help with meal assistance. They provide range of motion exercise, or if the patient's able, they can get them up and walking. We also provide orientation as well as therapeutic recreation. So with these interventions, we try and keep our older patients oriented to their time and space, as well as keeping their mobilization up and keeping them strong so that they can go back home or back to their retirement home.
Once again this year, our community has been generous to Groves. Gifts come to us in many forms. Donors give monthly or annually. They leave bequests in their wills to protect the future of Groves, and they can give in-kind donations like our new digital displays. This year, Heritage River Retirement Community provided digital display monitors for the hospital and participating physician offices. This great new communication opportunity provides Groves and your family physician another way to communicate with you. Thank you to everyone who participated on our Get Real posters. Physicians, nurses, and staff worked with Amy Cooling Photography and Mach1 Communications to produce an award-winning campaign poster.
From a financial perspective, 2012-13 was also a successful year for Groves Hospital. We managed to balance our budget given the limited resources from the province and the cooperation by our staff.
Details on the plans and progress of the project can be found on the hospital's new website, which was launched this spring and includes new improved functionality for patients and providers, a video education area, feedback portal, and many other things. And I would encourage you to go on the site to keep up to date on the project and to find out what's happening with Groves. I'd like to thank and acknowledge the wonderful hospital staff, volunteers, physicians, Foundation for all their work through 2012. Their continued dedication to patient care, their focus on excellence that truly underpins all that we achieve at Groves. We look forward to a great year in 2013 and 14, and we'll continue to keep you updated on the new hospital project. In the meantime, I thank you very much for your continued support.